So let's have a look at a custom form, F2 BMD Custom form. We see here that the information is drawn from the chart into this table, and to the right you have quick way to handy links such as the osteoporosis guideline and other areas of the Osteoporosis Canada website. So we deemed our patient to be at low risk, but let's first do the 10-year fracture risk assessment tool. Our patient is a female, 68 years of age. Femoral neck is at minus 1.4 and lumbar spine is at minus 1.2. This puts her at low risk. Let's say she sustains a hip fracture. This brings her to high risk. Spine fracture also brings her to high risk. One non-vertebral fracture, such as a wrist fracture, brings her to moderate risk, while two brings her to high risk. If she was on systemic steroids, meaning the cumulative use during the preceding year at an average dose of greater than 7.5 milligrams daily, brings her to moderate risk. But if unfortunately she sustains a wrist fracture, brings her up to high risk. And we know that with the high-risk patient, that there's good evidence that the patient would benefit from pharmacotherapy. Let's go back to our custom form. So our patient was low risk, and we deemed her to be at high risk. Well, this brings the information from the chart of the last EGFR and also brings you to the first-line choices of pharmacotherapy. Let's remove this. Now let's say your patient was at moderate risk. The guidelines suggest that you should perform a thoracolumbar X-ray. Let's choose. You will see here that the requisition becomes populated in the chart and is pre-populated with the information to proceed to the lateral X-ray of the spine. Once the result comes in, then you proceed to your review the risk factors of your patient. If any of these are said to be yes, then there is good evidence that the patient would benefit from pharmacotherapy. And again, we are drawn to the suggested first-line therapies. Let's remove this. And let's say that our patient did not have additional risk factors, then the recommendation is to repeat in 1 to 3 years, along with encouraging healthy bone health, such as regular exercise, calcium, vitamin D, and fall prevention strategies. And now we can add to the note.